Hi, my name is Corey. I'm going to be your nurse today. What's your name?
John Doe.
John Doe. Okay, John, I'm going to wash my hands for 30 to 40 seconds to prevent the spread of infection. I'm just going to provide you with some privacy. Pull this curtain right here. And John, can I see your bracelet? John Doe, what's your date of birth?
1101.
Perfect. Why are you here today?
Annual physical.
When was the last time that you were seen by a doctor?
Last year.
And why?
Another annual physical.
Okay, perfect. Okay, I'd like to perform the physical today. Is that all right?
Absolutely.
Do you have any allergies?
No.
Have you traveled outside the U.S. during the last 30 days?
No.
You don't have any medications at home?
No.
Okay, perfect. Okay, so do you know where you are?
I'm in the hospital.
Okay, and do you know the date?
It is April 18th, 2018.
Okay, and the patient is alert, awake, and oriented ×3. The Glasgow Coma Scale is a scale testing eye opening and motor and the nervous system, and I would give you a scale. It's a scale of 15 to 3, and I would give you a scale of 15. I would like to start off by having you walk over to the scale, and so I can take your blood pressure or your weight. Okay, perfect. You can go back and sit down. So your weight was 137.3. 137.3 with that weight and with a height of 5'7", this would give you a BMI of 21.5. According to the CDC, the body mass index, they've created the scale for recommended weight based on height, and so yours is 21.5. The scale is 18.5 to 24.9, and that would show a normal BMI percent number. And under 18.5 would be considered underweight, and over 24.9, so 25 to 30, would be considered overweight, and over 30 would be considered obese. So you're doing well. So some questions for you, or just to take a look. When I noticed when you were walking to the scale, you had your gait was well balanced, well coordinated, even, symmetrical bilaterally. Your face is symmetric, well calm. Your speech is clear. You're cooperative. Your speech is well organized. You're well groomed. So these are all good things and expected findings. Talking about BMI, when you talk about underweight, so if there's some reasons for being underweight. It could be homeless people, lack of access to food, dental caries, allergies, food allergies, diseases, things like that. People can get underweight from that, and it can cause severe issues, growth and development issues for the children, and for others it can cause weight muscle loss, which can lead to falls and things like that in the elderly. Being overweight can cause some issues like or it's caused by simply overeating calories and fat, and or sedentary lifestyle, and this can lead to cardiovascular disease and diabetes mellitus. So definitely a good thing to stay in the right weight range. Then I'm going to take your vital signs. So talking about, let's first take your blood pressure. So I'm just going to place this in the upper arm, aligning my arrow with the brachial artery. And I just place my stethoscope here. The arm should be at the level of the heart. A little difficult to that was 114/74. This is a normal blood pressure. It's good range. Normal blood pressure is anything systolic under 120 and diastolic under 80. Anything 120 to 139 is considered pre-hypertension, and 80 to 89 diastolic pre-hypertension, and then anything above that, 140 and above, is stage 1 and 2 hypertension. And then anything 180 over 110 and above is a hypertensive crisis. I would also take your pulse. I'm not going to do it today, but I would just place my finger on the radial pulse site, the radial artery here, and count the pulsations, the beats per minute, and double that to get beats, the rate, which is the beats per minute. The normal rate is between 60 and 100. So anything under 60 would be bradycardia, and anything over 100 would be tachycardia. So it's an increased pulse, tachycardia, and a decreased pulse, bradycardia. Now, while I take your blood pressure, or while I take your, and that would be done on both arms. While I take your pulse, I also would watch the rise and fall of your chest and measure your breaths per minute, and that's your respirations. Normal respirations are 12 to 20. Over 20 respirations is called tachypnea. It's rapid breathing, and under 12 would be bradypnea, and that's a decreased breathing. So we want you to be within the 12 to 20 range for respiration. Our other vital sign, we have the temperature. For temperature, the most effective temperature would be oral temperature. The normal oral temperature is 98.6. That's under the tongue. We also have the increased temperature is a normal reading is a little increased in rectal and in oral in the ear. And that would be a 99.6. This can be off by like 0.1 or 2, and still be considered normal. And then the auxiliary temperature is the least effective. It's under the arm, the armpit, and that reading is generally comes to be lower at like around 97.6 Fahrenheit. So that's our temperature. Our fifth vital sign is our pain. Are you feeling any pain today on a scale of 0 to 10? 10 being the worst pain you've ever felt, and 0 being no pain?
0.
0 pain? So that's the numeric pain scale. We also have several other scales. So the Wong-Baker scale is a series of faces, starting with a elated, happy face down to a very sad, somber face. And it's great for children mostly, but also other people that need it, to point to the scale or to the face that depicts how they're feeling, and that's how you can test pain. And then there's the Flack scale, and that is like we in my practice we use that for newborns, and it can also be used for people that can't speak for themselves. They're unable to self-report. That's the Flack scale. We also use an acronym OLD, CART, and ICE to really quantify the type of pain and you know the quality of the pain. So for example, OLD CART, so each letter, it's an acronym. So O is onset, so when did the pain start? Location is the L, so where is the pain? So that's the OLD CART and ICE. So now I'm going to do a skin assessment. So I'm just going to take a look at your skin, and your skin is normal for your ethnicity. It is consistent throughout the body. There's no signs of ecchymosis. Ecchymosis is like a bleeding that would show up under the skin, like bruising. No signs of cyanosis, which is like a bluing, showing areas where there's no blood flow, cyanotic areas. So there's none of that. I don't see any unusual lesions or moles, any rashes. Just touching the skin feels nice and warm and dry. You would expect thickened areas of skin on the bottom of the soles of the feet and the hands, at the joints like the elbow and the knee. You see thickened areas of skin, and that's normal. And then thin areas you can see on the lips and on the eyelids, and that's a normal finding as well. So just looking at the skin, this is a normal finding. I would just give a little pinch to the skin to test for skin turgor, and the skin is elastic. And that's a good a sign of good hydration in this individual. If we were to see any signs of like moles or abnormal lesions, we can use the acronym ABCDE, and that's how we assess skin cancer. So if we saw a mole, we can say, so is the border, are the borders asymmetrical? The asymmetry is the A, borders is the B, color is C, D is the diameter, and E is evolving changes. So we kind of monitor those type of things and the changes and how the size and things like that. We want to really provide really good education to our patients about preventing skin cancer. So I recommend it's recommended that you use a SPF of 15 sunscreen, and you reapply it throughout the day, and you use to avoid UVA and UVB rays. Sun protective clothing, a wide brim hat, avoid midday sun, these kind of things. Just looking at your head. Your head is looking at the head. The head is normocephalic. If I can just touch you and you let me know if there's any pain, if you feel any tenderness.
Okay.
Okay. So just feeling the head. The head is normocephalic. The hair is thick and brown, medium length. There's no signs of nits. There's no missing patches of hair on the head. I don't feel any lumps. The patient's reporting no tenderness on the head. And then moving down, I'm looking at the temporal artery. I see no pulsations on the artery. Also no pulsations on the carotid artery. Looking at the face is symmetrical. It's relaxed, and the features are symmetrical. The skin is ethnically appropriate and the same as the rest of the body. And then I would go ahead and look at the ears, and if I observe the outside of the ears, I don't see any drainage. There's no hard nodules, any swelling, any tenderness on the tragus. You feel any tenderness here? Any tenderness on the mastoid?
No.
No tenderness. I'm just going to take a look inside of the ear. I'll look at this one. So I'm just taking a look on the outside of the ear, and like I said, there was no drainage or anything inside. And I'm going to pull up on the pinna and pull back and take a look at the tympanic membrane. And the membrane is visualized. It's a pearly gray, and it's intact. I just want to point out the lymph nodes. So we have the preauricular, the postauricular, the tonsillar, the occipital, the submandibular, the submental, the supraclavicular, the deep cervical chains, and the superficial cervical chain. And so coming from the ear to the nose, I'm going to go ahead and take a look at the inside of the nose. So looking at the outside of the nose is a normal shape. There's no swelling or drainage on the outside. The color is good. No inside there the septum was visible, and the nares are patent and clear. Now I'm going to go ahead and take a look at your eyes. So looking at the eyes, the pupils are even and round, and the eyes are symmetrical on the head. The pupils are a green color, and now I'm going to test for the red light reflex. And the reflex is visualized in the patient's right eye, and as well in the left. And I'm just going to take this light, my pen light, and I'm going to ask you to go ahead and stare at the wall right here. Okay. And now look at this thing. At the pen light, perfect. And so that's Perla. The pupils are equal, round, and reactive to light and accommodation. Now I want to go ahead and test the cranial nerves, the cranial nerve 3 oculomotor nerve. So I'm just going to stand here in front of you, and I'm going to ask you to follow the pen light. So that's cranial nerve 3, the oculomotor nerve. Now I'm going to test for, I need to end my card. I have to get a clear card. This one's empty. So just hold this in front of your eye. Okay. And then I'm going to hold it in front of the same eye. It's a blank card. And then I want you to tell me when you see the pen light, okay? Right now we're testing the peripheral gaze, the peripheral vision. So you tell me when you can see the light.
I can see it.
You can see it?
Mm-hmm.
Okay. Now tell me when.
I can see it.
Okay.
I can see it.
Okay. So the peripheral vision is intact. Now I'm going to do the Weber and Rhine test. The Weber test tests cranial nerve 8, the vestibulocochlear nerve. You tell me when, if you can hear it equally on both sides.
I can hear it equally.
I'm going to try it one more time.
I can hear it equally.
Okay, no lateralization, so there's the hearing is equal on both sides. So now we're going to do the Rhine test, and this is testing air conduction and bone conduction. So I'm just you tell me when you can no longer hear it when I place it on your mastoid bone. Okay, now tell me when you can no longer hear it.
I can no longer hear.
No longer hear it? Okay. So the the air conduction is twice that of bone conduction, and that's a normal finding. Let me know when you can. I'm going to whisper something to you, and I would like for you to tell me what it is that I say. Okay?
Okay. Apple. Cherry.
Okay. Great. So that's the whisper test. So now I'm going to test the cranial nerve 1, the olfactory nerve. And I'm going to place something under your nose, and I want you to tell me what you smell.
Alcohol.
That's right. I also want to test the cranial nerves 9, 10, and 12. So cranial nerve 9 is the glossopharyngeal nerve. Cranial nerve 10 is the vagus nerve, and cranial nerve 12 is the hypoglossal nerve. And we're testing gag reflex and taste and swallow. So I want you to go ahead and take a sip from here. And swallow. And then, I guess that wasn't really for me. And then I'm going to test your gag reflex. Open up wide. And that's the gag reflex. And then the taste. And so I'm going to have you take one of these sweet tarts. And how does it taste?
Sweet and tart.
Sweet and tart. So that's our 9, 10, and 12 cranial nerve. Okay, so I'm going to test cranial nerve 11, the accessory muscle. This is also testing shoulder muscle resistance. So go ahead and shrug your shoulders. So that's cranial nerve 11, the accessory muscle, as well as the resistance. We would test for jugular vein distension, and this would be done by placing a ruler. The patient would lay down. I would place a ruler down laterally across the chest, horizontally, and then place one vertically, meeting up with this ruler. And then the horizontal ruler would be lifted to the level of the top of the jugular vein, and then the number would be read on how distended it is, and that's how you test for jugular vein distension. I'm just going to listen to your carotid artery for any bruit, using my bell of my stethoscope. There's no bruit heard. A bruit is a whooshing, it's a soft, like blowing, whooshing sound, and it's an indication of narrowing vessels, and it's not heard in this individual. I also like you to go ahead. I'm going to check for deviation of the trachea, and the trachea is midline. I'm going to ask you to turn your head. Very good. And swallow. And this would be checking for the thyroid gland. It's non-palpable, and this is a good finding. Also going to check for the epitrochlear node here. So I'm just going to hold your hand and palpate here for the epitrochlear node. It's here between the bicep and tricep. It's non-palpable. A tenderness or an enlarged node would indicate infection in the hand or arm. It's non-palpable. And you also there's the same thing for the inguinal node, which is just here in between the thigh and the torso and midline, and it should be non-palpable. It can be sometimes a small amount palpable and movable, but it should not be enlarged, and it should not be tender. And if that is the case, then there's likely a sexually transmitted infection or urinary tract infection. So I'm going to now test your lungs and your cardiac assessment. So if you can please remove your shirt. Okay. Actually, let's do the Allen's test before I forget, since this kind of goes along with the cardiac assessment. We do it with the pulse usually, but so the Allen's test is a test to check the patency of the arteries that are giving blood supply to the hand. So you have the radial artery and the ulnar artery, and I'm just going to occlude the radial artery. I'm going to ask you to open and close your hand, and open. And the hand pinks right up. And then I'm going to occlude the radial artery and ask you to do the same. And when I open you open your hand, it pinks right up. And this is indication of a patent radial and ulnar artery, because they both, when one was occluded, the other was supplying the blood to the hand. It's a really good thing if you're putting in like an arterial line. You want to make sure that the other artery is working. So I'm just going to take a look at, inspect your chest. So the chest is consistent color with the rest of the body. There's no signs of heaving, no use of accessory muscles, retracting, none of this occurring. The transverse diameter is twice that of the antero-posterior diameter, and this is an expected finding. When the chest is wide here, that's a barrel chest, not a good finding. Looking at the skin on the chest, no signs of lesions, moles, rashes. The chest rises and falls unlabored and symmetrical. I'd like to go ahead and do the lung assessment if you can turn around. Okay, so I'm just going to take a look at the back of the chest, and the thorax is even on symmetrical rise and fall. I'm going to ask you to take a deep breath, and one more time, and the hands move symmetrically, and when he breathes, and this is a good sign. I'm going to do the test for fremitus now. So we're looking for good vibrations within the lung fields when the patient says 99. So I need you to go ahead and say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So there's fremitus throughout the lung fields, and this is an expected finding. If we were to not feel the fremitus, the vibration could be some sort of fluid backup or blockage in the lung fields. So that's a test for that. Now I'm going to check for resonance by percussing the lung fields. Resonance. So you're going to have resonance in the hollow areas of the lung fields. So, and you're going to feel dull if there is some sort of mass, or if you're percussing over a bone. So we had resonance in the lung fields, clear, and now I'm just going to listen to the lung fields. So I'm going to ask you to, this is a lot of breathing in this exam, so I'm going to ask you to take some deep breaths for me, and you can do that at your own pace. Let me know if you need to stop. Over to my diaphragm, and go ahead and take a deep breath. Deep breath. Okay, so the lungs are clear bilaterally. And now I'm going to ask you to go ahead and turn back around so I can listen to your heart sounds. So now we're looking for the, I'm going to go to the second intercostal space, and I'm going to listen to the aortic sound, second intercostal space, mid-clavicular line. And second intercostal space, mid-clavicular line, the pulmonic. Third intercostal space, mid-sternal line. This is Erb's point. Fourth intercostal space. This is tricuspid valve. Fifth intercostal space, mid-clavicular line, point of maximal impulse, mitral valve. At the mitral valve, glasses on. At the mitral valve, S1 is going to be, at the mitral valve, S1 is going to be greater than S2, as well as at the tricuspid valve, and that's what I heard. At Erb's point, S2 and S1 were the same, and then at the aortic and the pulmonic, S2 is greater than S1. I'm going to ask you to lay back. I'm going to do the abdominal assessment. So, in this situation, I'm going to take a look at the abdomen, and the abdomen is round and symmetric. Even bilaterally. There's no signs of pulsations of the from the aorta. The patient isn't reporting any pain in the abdomen, but if the patient were, I would avoid that part of the abdomen and assess the rest of the abdomen first. So the abdomen is non-distended. We do abdominal assessment a little different. Usually we do auscultation last, but with the abdomen we'll do that first. Inspect and then auscultate, so as to not stimulate the abdominal area. I would just listen also to the aorta, the descending aorta. And to the renal arteries. I would start my assessment with the abdomen in the right lower quadrant, and listening for 1 minute in each quadrant, up to 5 minutes for the whole abdomen. And here's where Borgimus in the abdomen quadrants, and this is like a gurgling noise. And this is a normal finding. You can hear decreased sounds in the abdomen. Hypoactive sounds would be normal in the post-op patient. And then hyperactive sounds would be normal in the patient that's suffering from diarrhea or gastritis. And borborygmus is a normal finding as well. Right, just here in the right upper quadrant, you would find the liver, and here in the left upper quadrant, you would find the spleen. I'm just going to percuss these areas, the quadrants. And you might find like a dull sound if you go over an organ, and that would be a normal finding. So I guess now I should go ahead and do the reflexes on the patient. So I chose the reflex to do the knee reflex, the patellar reflex. What I would like for you to do is to go ahead and extend your knee, and this is extension, and then if you would go back, that's flexion. Okay, and then I'm going to check the reflex here, and this is a positive reflex, +2, so we do reflexes on a +1, +2, +3, +4 scale. +2 is normal. +3 is a little increased. +4 is hyperactive with clonus, and +1 can be acceptable. It's just like it's a low normal. Also was going to do the Achilles reflex, so just here, and I would I'm just going to support your leg. Okay, relax. And this is a positive reflex for the Achilles tendon. Now I'm going to check the strength of the muscles, right? So we check the strength of your shoulder muscles. Now I'm going to ask you to turn your face, and the other way, and that's good strength of the neck muscle. And I need you to lay down. And now I'm just testing the strength of the knee. So I want you to go ahead and bend the knee. Okay, and back. And lift the hip. Okay, and put the hip back down. Okay, good. And of the feet and the back the other way. Perfect. And of the ankle, so turn your leg in the other way and this way. Perfect. And then I'm going to do your hand, so and the other way. Perfect. And that's my muscle strength assessment. And let's see, what am I missing? The urinary system. So with the urinary system, we would expect a patient to have about 1,500 mLs of urine a day, and that's about 30 milliliters per kilogram per hour. And the urine should be like a yellow straw colored. You're fine. A yellow straw covered and urine, and should be clear, and no blood and no foul odor. let's see. So a couple of words to define the hematuria. So hematuria is blood in the urine, and nocturia is urination during the nighttime. And that's like not a normal finding. It's nighttime urination after 4 years old. Oh, let me check your kidneys. Actually, if you can just. So this is the costovertebral angle. So we go down to the 12th rib, and I was just inspecting this area and looking for any signs of like ecchymosis. It's called It's called. Hold on, let me think of it. Well, anyways, the name, I can't remember the name of it right now, but it would be an indication of peritoneal bleeding, any bleeding in the area, and it would show up in this area, and there's no indication of that. The patient does have a birthmark here, but then I would just, I want you to tell me if you feel any pain. You feel any pain when I palpate? No. There's no swelling here, and there's no redness, so there's no indication that there's an issue. The patient doesn't report any pain upon palpation. And then now I'm just going to percuss. So you would just put your hand like this, and any pain?
No.
No pain. The costovertebral angle. So any pain here would indicate some sort of renal disease, and the patient's not reporting that. So additionally, let's talk about women's health. So we recommend that women start to get a pap smear at 21 years old within 3 years of sexual activity, of the first sexual activity. And from 21 to 29, we recommend that the patient receives the pap smear every 3 years. And then from 30 to 40, from 30 to 65, we recommend that the patient gets a pap smear every 5 years. And these would include an HPV testing. And then from after 65, if there's no history of dysplasia, we can then stop doing the pap smears. Mammograms, we recommend that they're done between 40 and 44 years old. The patient can have the mammogram if they choose to do so. But then at 45 to 54, we recommend that they get the mammogram every year. And then from 50 to 74, we recommend that the mammogram is done every 2 years. We also recommend breast self-exams, and this is recommended in the shower, and testicle exams are also recommended to be done in the shower. But you can also do breast self-exams lying on the bed or in front of a mirror, and you just lift your arm above your head, and then with your other hand, you would just do a circular motion and palpate the entire breast from the outside to the inside, and you want to look for any thickened areas, any nodules, any bumps, lumps, something different. You would notify your healthcare provider if you were to notice any developing changes in your breast tissue. Then we recommend the HPV vaccine. That's for males and females, and that's starting at age 11 or 12 and going all the way up until 26 years old. And it's a 3 injection vaccine. So that's recommended. And then with the testicle self-exam, you want to go ahead and do the testicle exam monthly as well. Oh, with the breast self-exam, we recommend that to be done within or once you have finished your menstrual cycle. wait 1 week and then do your breast self-exam, at least 1 week. And then with the testicle exam, you want to do that in the shower and with warm water. You do it every month. You start it between around age 13 to 15, and then you go ahead and palpate the testes, and you're looking for any nodules or anything irregular. There's also the PSA, which is a blood test for the prostate to check for any abnormalities, and that's something that's done based on your risk factors according to the recommendation of your healthcare provider. And digital rectal exams are also done sometimes they use it in congruence with the PSA, and that's also recommended by your healthcare provider according to your risk factors. So I just want to do a few tests for your neuro tests before we finish up. So I'm going to have you do the finger to nose test. So if you just put your hands out, close your eyes, and touch your finger to your nose. And the other. Perfect. And then I want you to do the tandem test. So I'm going to have you walk here. So you can just film him walking. So in this test, you would walk with your heels into your toes. Yeah, and now right, exactly. Walk across. Yeah. And as you come back, I want you to walk on your tippy toes. And then now walk back on your heels. Okay. Then have a seat back down. Sorry, I just need you to lay back down for a moment and do the heel to shin test. So go ahead and put your heel on your shin and rub it down to the end and back up. Perfect. And then I want you to close your eyes. I'm going to put something in your hand, and then I want you to tell me what it is.
Seems like a bottle cap, hard, plasticky, has a hole in one side.
Perfect. That's exactly what it is. It's a bottle cap. So that's testing for tactile discrimination, if the patient can tell what it is that, without looking, if they can use their nerves to tell. Now I'm going to test also for kinesthesia. So what I'm going to do is remove your sock, the other sock, and then, okay, so this is down and this is up, right?
Mm-hmm.
Close your eyes.
Okay.
And what is this?
Up.
And what is this?
Down.
Perfect. That's correct. You got it? Now, in the beginning of the test, in the beginning of the exam, I asked you I told you to remember 5 words.
They were very university nurse rubber ducky.
Correct. So that is those words were testing your cognitive function. Very good. I think there's a couple things that I'm forgetting. So fine rails, adventitious breath sounds. So fine rails are on inspiration, a harsh blowing sound. Increased harsh sound, and those rails are caused by fluid-filled alveoli. And then crackles are caused by fluid-filled alveoli. And fine rails are caused by an obstruction or asthma. And then I had I wanted to talk about the heart sounds. So we have S3 is a vibration that comes from the filling ventricles. It starts in diastole, and it can be normal for children and pregnant women, but it can also be a sign of disease. And S4 is almost always indicative of disease, and it's happens at the end of diastole. And then heart murmurs, it's like a blowing, swishing sound, and it's graded from 1, which is a barely audible sound, to 6, which is the loudest sound. I also believe I forgot to talk about the grading scale for the amplitude of pulse. And so just in case I did, the pulse is on a scale of 0 to +4. 0 is an absent pulse, +1 is increase, +2 is normal, +3 is increase. +1 is weak or thready, +2 is normal, +3 is increase, +4 is bounding pulse. And then I wanted to test also the facial cranial nerve, which is the cranial nerve 7. I'm going to use this cotton wisp. And how does this feel?
Soft.
That's right. And so I'm just going to tell me when you feel it.
I feel it. I feel it. I feel it.
Okay. And then we also do the soft testing. It's a neurological test. So you felt that on your face. That's cranial nerve 7, the facial cranial nerve. And then how does this feel?
Soft. 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 Soft.
Okay. And then on the foot.
Soft.
Okay. And then the pulses of the body. We have the carotid. You have the brachial just here. Yeah. You have the radial pulse right here. Just behind the knee, you have the popliteal pulse. Just go ahead and keep your leg flexed. You have the popliteal pulse. This is the dorsalis pedis, just here on the top of the leg. Let me go ahead and palpate it for you. Right here. And then just behind, on the other side of the foot, you have the posterior tibialis, in front of the Achilles tendon. And that concludes my exam for today. Thank you so much.